There has been a lot of discussion recently worldwide about free birth. Free birth meaning birth without medical assistance. Perhaps you heard about it and you think it's completely irresponsible and it's frightening you. Maybe you are on the other side, that the over medicalization of birth makes you feel anxious about giving birth to your child in a hospital. So let me tell you in this video my alternative perspective and my understanding of free birth. Because working somatically with women bodies for over 6 years showed me that creating powerful birth experiences is about something completely else than just choosing the right place for your birth. And it is really about becoming free from the things that limit your capacity of making conscious decisions. So in my work, I've come to understanding that many difficult birth experiences are shaped long before the labor begins. And it is the small decisions that you're taking during pregnancy, decisions taken from a place of fear, of uncertainty, of doubt, that are slowly creating a path to the birth that is not really feeling aligned with you and not with your family. So we often tell pregnant women that the goal is simply to stay calm during your pregnancy, to stay positive. But in my experience, the true confidence in birth comes from something completely different. It comes from being honest with yourself and ready to confront your fears. Because when you truly understand what scares you, you can make choices from awareness rather than fear. And sometimes we think that facing our fears, that looking at them, pondering on them, that it will create the reality that we are afraid of. But it is completely not true. Actually, taking them from the unconscious and making them conscious, looking at them, gives you more ability to choose consciously about the birth of your child. So, birth education is the most powerful tool you can have. Knowledge gives you options, gives you choice. It helps you understand the different paths available to you and your family. For example, I had many male partners of my clients who initially were afraid of home birth. But after getting the knowledge about birth physiology, about understanding risks and benefits in different birth settings, and discovering really their role as a supportive partner, their perspective on home birth changed. So, education doesn't mean choosing one specific birthplace, but it is really about understanding your choices. Because when you have more choices, you can stay grounded and confident even when unexpected situations happen. So, one of the biggest sources of birth complications are unresolved conflicts. Unresolved conflicts during your pregnancy. For example, you want to give birth in a hospital, but you think it is too far from your home, that the way will be too long. Or you want to give birth at home, but you don't really feel safe and comfortable in your body with your birth team. Or you want to birth with your partner, but he carries a lot of fear around home birth. So when these conflicts stay unresolved during pregnancy, it can really influence the way you experience your birth. The journey to the hospital can become overwhelming. Medical decisions can feel frightening instead of empowering, or the partner who is acting from fear during birth may unconsciously take decisions or convince you to make decisions that actually will make him feel safer rather than supporting you as a birthing woman. So this is why bringing these conflicts to the surface is so important. And when we see them clearly, when you see them clearly during pregnancy, when you can look at them clearly, you can really make decisions from a place of consciousness. So this is exactly what I'm going to talk about in my next video, make the right decisions in birth. So make sure you subscribe not to miss it. And if you feel stuck between different choices, if you feel fear or uncertainty about your birth plan, start exploring these questions that I'm going to make in the video before your birth begins, because your birth starts long time before your first contractions do.